This audio overview was generated using AI for educational purposes by Carey Family Dental and does not replace a consultation with your dentist. So today we're doing a deep dive into something that, well, it's probably the #1 reason people lose teeth, but most of us don't even know we have it until the damage is pretty far along. We're talking about periodontal disease.
We are, and the real goal here is to, demystify it.
Right, not to sound like a lecture.
Exactly. Think of it as a guide. When you understand what's actually happening below the gum line, the treatment plan your dentist talks about stops feeling so mysterious. It just becomes a clear path forward.
Okay, so let's start with the words themselves, because I see gingivitis and periodontitis used a lot. They're not the same thing, are they?
Not at all. Gingivitis is really the first warning sign. It's an infection just in the gums. You'll see some redness, maybe some swelling, a little bleeding when you brush.
And the key thing there is that it's reversible.
It is, absolutely. With good home care, you can turn it around. But if you ignore that warning, that's when it can progress to periodontitis.
And that's the one that affects the bone.
That's the one. The infection moves deeper and starts to attack the actual ligament and the bone that holds your tooth in place. That's when we see permanent loss of support.
I came across a really great analogy for this in the research, the turtleneck sweater.
Oh, that's a perfect visual.
Healthy gum fits snug around the tooth like a brand new turtleneck, right?
Exactly. But with periodontitis, that collar gets stretched out, gets baggy.
And then food and bacteria can fall down into that little gap, that pocket.
And that's the whole problem.
Mm-hmm.
It creates a space between the gum and the tooth that your toothbrush just physically cannot clean.
So once those pockets are there, the risk factors changed completely. It's not just about how well you brush anymore, is it? I was surprised to see how big of a role genetics plays.
It's huge, and that explains why some people are so diligent with their hygiene and still have issues, while someone else might not be and seems fine. It's a really complex mix of things. If your parents had trouble with their teeth, or if you have diabetes or even high stress levels, your body's inflammatory response is just different. Certain medications can even play a role.
So not a personal failing, it's just biology.
It's biology. And that's why the treatment have to be personalized. A standard cleaning isn't going to fix those deep pockets.
So what does? What's the approach then?
Well, the main non-surgical treatment is something called scaling and root planing.
Which is basically a very, very deep cleaning.
It is. We're getting below the gum line to clean the tartar off the root itself. We're trying to smooth it out so that turtleneck sweater, the gum tissue, has a chance to tighten back up.
And I saw that sometimes surgery is an option for more advanced cases to sort of reshape the area so you can actually clean it at home.
That's right. But here's where it gets really interesting. You can get rid of all the bacteria, do a perfect cleaning. But the bone might still not heal if there's another problem. That is the bite. It's the missing link for so many patients. Think about it. If a tooth is already weakened by infection, and on top of that, it's getting hammered by a bad bite or from grinding at night.
It's a double whammy.
It's a double whammy. The body just can't heal. You have this bacterial infection and this constant mechanical trauma happening at the same time.
So it's a structural problem too. You have to stabilize the foundation.
You have to.
Yeah.
Which is why your dentist might look at your occlusion, how your teeth fit together. We might talk about a bite guard or a procedure to just gently balance the biting forces. We have to take that physical stress away so the biology can do its job.
And this all connects to the bigger picture, the why this matters part.
Yeah.
We're not just trying to save a tooth. The research linking gum disease to things like cardiovascular health.
Yeah.
It's really strong.
Incredibly strong. I mean, the mouth is a gateway to the rest of the body. You can't really be in a state of total health if you have a chronic active infection sitting in your head. It's connected to rheumatoid arthritis, diabetes control, and for pregnant women, even risks like preterm birth. It's all one interconnected system.
It really makes it clear why these protocols have to be so personalized. Whether it's that deep cleaning or a bite guard, it's all tailored to your specific situation.
It is. And honestly, just understanding the plan is often the best antidote to any anxiety you might feel. Once you know what's happening and why, you're back in control.
So it leaves us with one final thought, really. If your mouth truly is the gateway to your body, what message is yours sending about your overall health right now?